Gently, Dr. Bunglehole. Oh! You shave. Oh, God, look at the hooks. Look at the hooks. They're going to go into her nostril. Oh,
now with the nostril
that is a
opened
big-ass
wide,
nostril.
we'll make
Oh, God,
Now
I nearly
that
went
the
into her
hump is
fucking
loosened,
brain. Is this... Are we having intercourse with her nose? Hey, guys. Welcome. Today, we're back with the one and only Dr. Bunglehole. Oh, yes, I don't know what the fuck that was. Shit, look at this. Laser lipo training. Holy shit. It only cost me $1,000, guys. This is how the Bunglehole thrives. MD, PhD, OG, all online. Every single goddamn letter. All online. And I did a little quick course down in Colombia, but that was mainly about removing cocaine from breast implants. That was a fun month. That was a fun-ass month. But anyway, today we're doing rhinoplasties because it's a nose job and I've seen one of these in real life. I used to watch that fucking Home and Health channel with, what was her name? Dr. G. Dr. G! She used to do boob jobs and all kinds of shit. It was graphic as fuck. I loved it. So yeah, I figured a rhinoplasty, I mean, it looks nasty. It rhymes.
Welcome to Surgery Squad's virtual closed rhinoplasty surgery.
Where is Dr.
I'm Dr. Susie.
Dr.
Today
Susie.
we will be performing rhinoplasty.
Where's the guy?
It's what's commonly referred to as a nose job.
Yeah.
In this cosmetic surgery,
we'll perform a closed rhinoplasty procedure to reshape her nose into something she finds more appealing.
I prefer to work with a patient numb and in a dreamlike state. What we're doing today is
wrong with this
reshaping
woman's
the bridge
hair?
of the nose. Our patient feels it's too wide and doesn't
What's
like
that
the
other
hump
doctor's
on it.
name?
The
God
thinning
damn it,
of
I
the
cannot
nose
remember.
is called an infracture.
Dr.
I'll
I
bet
keep
you
thinking of
can't
Dr.
guess what
Phil.
the widening of the nose is called.
Dr.
All right, I'll tell you. It's an outfracture. Some patients may also want the tip of the nose reshaped. That's called typoplasty. But as I was saying, this patient only...
Oh.
To begin this procedure,
We're gonna
we need to open the
shave.
nostrils as wide as possible.
Can you
We do
flare your
this with a
nostrils?
retractor. Can you place the retractor in the patient's right nostril?
I have to do this now? Girl, you shave. Oh, God, look at the hooks. Look at the hooks. They're going to go into her nostril. Oh,
Now with the nostril
that is a
opened wide,
big-ass nostril.
we'll make an incision inside in a crescent moon shape.
Oh.
That will allow us to access the bones and cartilage that make up the nose structure. I've made the incision. Can you use the forceps to remove that portion of the nostril?
Bitch, I wanted to cut her.
Surgeons must be hyper-vigilant when doing this portion of the procedure, as it can damage breathing and sense of smell.
Okay, I should be very careful. Yank it. Yank it. Rip it. What is happening? Do it.
To
Nailed
reshape
it.
the nose, we're going to chip off the dorsal hump with a chisel tool called the osteotome.
That dorsal
We
hump.
place the osteotome at the base of the
See,
hump
we're
and
shaving.
then carefully
I
tap
knew
on
it.
it with a small
Chiseling.
rubber mallet. This has to be done very gently and takes a careful touch. I'll position the osteotome and you tap the end with the hammer.
We're going to chisel this woman's nose off. Plastic surgery is not gentle, guys. I've seen it. They are not gentle. They are not. Oh, God, look at it. Gently, Dr. Bunglehole. Oh! Oh, why? Oh, God,
Now
I nearly
that
went
the
into her
hump is
fucking
loosened,
brain.
We need to pull the bone and cartilage out of the nose.
Hump removal.
Use the tweezer-like forceps to slip it out of the incision.
We're slipping it in. And then we're going to... Oh, it's going in her nose. Oh, we're penetrating her nose. Is this... Are we having intercourse with her nose? Oh.
Now that the bump is out of there, we need to smooth the edges on both sides with a rasp.
We're spackling. We're spackling her fucking
The
nose.
space left by the bone we've removed is referred to as an open roof. To close the open roof, carefully tap the osteotome along the path that I've marked. This breaks the nasal bones so we can reposition them. Tap the osteotome once each time I reposition it on the left and right nostrils.
What? Dr. Susie, what? I mean, I was listening, but I Just get some polyfiller, man. No more nails to glue that shit. Oh, that was not gentle. Why are you doing that? Oh, no. Oh.
Now that the bones are broken, I just take my fingers and reposition them to close the open roof. Because we made such perfect breaks, the bones slip right into place and the nose is perfect.
Bullshit.
A few stitches to close up the incisions, and then we place nasal airway splints in each nostril to hold things in place.
Nose
Sterastrips go across the
scaffolding.
nose,
Yeah. Mhm.
and an external nasal splint is added to hold everything tight. Our patient will have some bruising and minor pain for a few days. We'll remove the splints in about a week. Most of the swelling will be gone by then, but there can be a bit left for a few months. And there we have it. Thanks for coming by. Catch more of my great surgeries here at surgerysquad.com.
Thanks for getting me there. Oh, you're welcome, Susie. You're welcome. Oh, that is a titty. That is a titty. We will do the breast implant ones in the next Dr. Bunglehole. So, goddamn, if you go in to get a rhinoplasty or a fucking nose job, why just keep your nose? Keep your nose. Keep it. Fucking keep it. You gotta chisel someone's nose, you gotta shave off that cartilage, break it open, seal it shut, add some scaffolding. What the fuck? That was like a proper cowboy job. Anyway, the next one I want to do is the carpal tunnel relief or release or whatever surgery. Because I may have to get this in the future, and I do not... God damn, I don't know if I want to see this. Carpal tunnel release, that's what it's called. I mean, I don't have really bad pain with it, but when I wake up in the morning, my fingertips are like numb, tingly. It's bizarre as fuck. So I do these weird-ass exercises. And if I don't do these exercises, then I'll need this surgery to relieve the pain. What is this beaten up baby? What is that? Anyway, this could be my future, so I think I should...
Welcome to Surgery Squad's virtual
What's your
limited
name?
open carpal
Phil?
tunnel release
No.
surgery. I'm Dr.
Jeff, that's it.
and I will
Fucking
be guiding you through the procedure today.
Jeff, I missed you.
Carpal tunnel syndrome is characterized by a tingling numbness or pain in your hand,
Yes.
and sometimes forearm. It develops due to the swelling of a ligament in the wrist known as the transverse carpal ligament.
Oh.
The swelling of the transverse carpal ligament creates pressure on the median nerve in your wrist. Is the main cause of carpal tunnel syndrome.
Yes, I
and the
know.
condition is more commonly seen in women than men.
Oh, I did not know that.
Researchers have also discovered that other medical problems such as alcoholism, arthritis, diabetes, obesity, and
Diabetes?
infections could also lead to carpal tunnel syndrome.
What?
Today we'll be operating on a patient who has been diagnosed with carpal tunnel syndrome after experiencing numbness and weakness in the palm of his hand and thumb. Now let's put on our gloves and get started.
Let's glove up.
The limited open carpal tunnel release surgery is performed using a local anesthetic that numbs the carpal tunnel area of the hand and wrist.
So you're awake.
If a patient is nervous or uncomfortable, I'll sometimes use a sedative as well. A sedative is a drug given through an IV
Oh, I know
that
what a
places
sedative
the
is.
patient in a dreamlike state. Go ahead and get the operating area numb.
Operating area. Dr. Jeff, you're so formal. I love it. Ooh, it's bleeding. Of course it is. You're stabbing someone with a needle, girl. It looks like a little mosquito
With the
bite.
wrist anesthetized, we can now begin the operation.
Great.
I've already tied a tourniquet around the patient's upper arm.
Is he going purple?
Can you go ahead and outline where we'll be making our incision?
Sure. Nailed it. Continue.
Looks good to me.
Fucking
We'll be
radishes.
making-
I was trained in
Now
motherfucking
take the
Mexico,
scalpel
sir.
and make the incision.
Drag the scalpel, make the incision in our patient's hand. Yeah, nailed it.
Nice.
I'm doing it,
I couldn't have
guys.
done it better myself. Now we'll spread the incision wider to expose the transverse carpal ligament.
Bunglehole is
This band
high
of tissue
on
is the cause
fucking...
of the problems.
What's the word?
Place the retractors into the incision and spread it open.
Isn't this how you give birth to a baby? Exposing. We have to expose. I'm scared. What are we going to see? Brace yourself if you're squeamish, because this could be nasty.
I think you're a natural.
Oh, that was dirty. What is
With the
that?
transverse carpal ligament exposed, I'll need you to slip a carpal tunnel guide into the incision.
You want me to slip it in?
This is a blunt-tipped instrument with a groove on the upper surface to accommodate a special knife.
Damn.
The
Can't
carpal
write
tunnel
this.
guide is placed down the carpal tunnel and underneath the ligament and is used to protect the underlying nerve and tendons.
That wasn't...
Go ahead and push the carpal tunnel guide into place. Once it's in position, you'll advance our special knife down the guide to split the carpal ligament. As you push the knife forward, you will feel it cutting through the carpal ligament.
Wait, why are we cutting it? I thought we were supposed to be pain relief. I didn't do anything. Oh, I cut it. Ooh.
With the transverse carpal ligament cut, the median nerve is no longer inflamed. Now we can begin to clean and close the incision. Go ahead and irrigate the wound.
Wait, that's it? You shitting me? That's it? How does that... What? I'm gonna have to Google this afterwards, Jeff, because you are not making this easy for me to understand. Maybe if I was listening, I probably would understand it.
When you're finished,
Oh,
I'll release
well,
the
you getting
tourniquet,
all up in
allowing
there?
blood to flow back into the hand.
Oh, you didn't need to be that rough.
Now you'll close the wound using non-absorbable
That was
sutures.
gross. Suture? I'm gonna suture this motherfucker. Oh, look at that little twirly twirl. That's cute. It's kawaii desu.
With the wound closed, we'll inject additional numbing medicine around the operating site to help relieve some of the immediate pain the patient may feel after surgery.
What the fuck was the point of this big ass line that I drew? Is it to help measure where to cut? I don't understand why we just sliced the nerve or the ligament, tendon, whatever the fuck it is. How does that help? How is his hand not just
And
flaccid
lastly,
now all the
we'll
time?
place a small dressing over the
don't
wound
get
to
it.
absorb any residual blood.
It's okay, I'll Google it though. Alright, mop up the blood. The endery chan style.
We'll immobilize the wrist with a splint and a sling, and after 1 to 3 hours, our patient is sent home to recover.
Really?
Our patient needs to keep in mind that because of some of the medications we used, he may experience a bit of nausea. He will also be given pain medication to help relieve the discomfort he'll feel in his wrist. Once our patient returns home, he'll be asked to follow specific instructions for driving, exercise, and medication.
Exercise.
This will include keeping his hand elevated above his heart for the first few days after surgery.
Days.
About 2 weeks after
Oh, look
surgery,
at all the
we'll
bruising.
remove our patient's stitches, and he'll be gradually allowed to return to his normal routines in 4 to 6 weeks.
What?
And that's a limited open carpal tunnel release surgery. Thanks for stopping
Limited?
by. Why not try out some of the other amazing
Is that
surgeries
what you get?
here on SurgerySquad.com?
Yeah, self-promotion. We're all good at it. Limit to what happens with the unlimited one. Is the limited one that you get with free healthcare? I'm not slagging off free healthcare. I love my free healthcare. I can't live without it, literally. I might need to get this surgery in some time. I'm not in pain, like I said, but goddamn, it's getting the. But that didn't seem that bad. It was a little cringy, but so are most things in life. That was very educational. I need to find out more about this motherfucking my carpal tunnel. That sounds like slang for my anus. Oh, the carpal tunnel. Yes. Take the tunnel less traveled, sir. What? Well, Dr. Susie and Dr. Jeff. Very educational and, as usual, very professional. Very gentle creatures, aren't they?
I prefer to work with a patient.
Numb and in a dreamlike state.
Goddamn. So yeah, I think, oh, that is a bloody ass baby. I think in the next one, we're going to do booby jabs. Because, we all know we're getting there, right? Yes, and a root canal. I've never had a root canal. I hear it's very painful. So yes, we'll have to do that. Gynecology. Alright, I got a suggestion, Surgery Squad. Under gynecology, you should totally have just, the checkup. The thing that we go to every so many months to make sure our vaginas are all healthy and working properly. Because, vaginal health is a great thing. Is vaginal a real word? I don't know. A smear. That's what it's called. A smear. Exam test. You call it something different in America? A pelvic exam or something? I don't know. You know where your doctor gets all up in your pussy. That one. They should totally have that here. It'll be great. It'll promote healthy womb awareness. Oh, yes. Healthy womb awareness. Anyway, guys, this was fun. This was educational. I hope you learned something. I definitely did. Although I am going to go and Google carpal tunnel release. What was it called? Limited carpal tunnel release? Whatever. I'm going to find out what the fuck is involved. Who knows? Maybe I will get it. Just for the crack. It looks like fun. I have free healthcare. Why the fuck not? Anyway, guys, if you enjoyed this episode, which I really hope you did, then you need to do something. What do I usually tell you to do? Oh, that's right. Like and comment. Because it really does help me out. I love them comments. I know I haven't had a lot of time recently to respond to any, but I have been reading them. I always read them. It's how I start my day. It really is. And it's fun. I love it. So yes, share, like, subscribe, and guys, share, like, subscribe, comment, and favorite. You cannot favorite. But I will see you in the next episode, okay? Until then, take care of yourself, okay? Bye. See, I already know this. I'm a fucking genius, bitch. Murray, you don't tell me nothing. Who do you think you are, Murray? Be careful, the baby's in there. Watch me rip. Oh, it's a baby. I'm not gonna giggle at the word anus every time, okay? I promise. Continue.
Carefully
I'm done
insert the scope into the patient's anus and slowly move it into the colon.
Oh. Really? It's all blurry. I can't see the butthole. What if I miss? What if I get it in her vagina instead? We're in her anus. Oh, I'm playing a game where I'm investigating a woman's anus. That's what's happening right now.